Hi all, my name is Santosh. I am a nurse currently serving the needy population in this COVID pandemic. In India, we have a pandemic has reached to that such a stage where nobody is able to predict what is going to happen. Only we are predicting that the cases are going to high. We may have more unprecedented incidences. This okay. Till now we had a oxygen demand was there. Now there's a medication demand. As also said, now we are seeing the health personals demand. We have seen Ministry of Health and Family Welfare and many other states announcing for uh, calling doctors and nurses to come and work for the daily basis, as a daily wage basis. Number one. Number two, private hospitals, there are only few. We are hearing that they need a nurses. That's a point to be noted. In parallelly, Dr. Devi Shetty, one of the great cardiac surgeon in India, has uh, cleared the how is the what is the need of a nurses and doctors and other paramedics or health workers in the total to combat or to take care of this pandemic situation. Yes, agreed. So now there are some proposals stating that there is a shortage of nurses. Yes or no? That I am going to discuss. Number one, existing government of India or government of Delhi or other states are trying to recruit the health workers on daily wages basis. So what could be problem with that and what can be done? What is the solution government can take? That is the point two I am going to discuss. Point number three, very important is if the some of the videos and some of the realities what happening in the ground, I am going to uh, take it to on this video. Thank you. You may be asking me why he is showing such kind of videos during the pandemic. This is the situation of one of the hospitals. I will read out. The Telangana Institute of Medical Sciences Hospital, Gachibowli, Telangana, had called for 36 contractual nurses post. Let me say contractual nurses post, and you can see the number of nurses arrived there to give the interviews for 36 posts. Here is a notice. One of the hospitals in the Delhi has said that they need a nurses and many other health staff, health workers for combating the COVID on daily wages basis. See, the nurses who are, everyone says nurses are the one who take care of the patients in the ICU. They are the warriors. We have also seen that last 2 days there were a series of events on the media about how nurses are taking care of the patients in ICU. If it is so, what is the it is daily based work, okay? Here in this hospital, they are asking for 3 months, 3 months of contract and 2000 rupees per shift. It means a nurse will work if she works 20 shifts uh, per month, which is very high with COVID all PPEs. But if they work 20 shifts, they'll get 40,000. Whereas I'm not comparing anything here with the other doctors or the super specialists and why they have to be given so much. That is not my question. My question is, if you think they are the one who are going to treat the patient, and why are you not paying them better? But I am not coming to the question of better here. The whole process of taking on contractual or wage basis is a question mark. For example, a nurse is working in one of the hospitals of the private hospitals in the Delhi. She will be also getting around 15 to 20,000 per month, and she worked for longer time. Why she or he will leave the job which he worked for 5 to 10 years and come and join the government service only for the COVID duty? Are we expecting more? Yeah. I presume there will be a lot of nurses who is joining are coming for this walk-in interview. as we have seen same in TIMS hospital and Telangana. Now, what could be done to resolve? Government could take another measure. Please do not recruit them on contractual basis or short contract as a 3 month or 6 month, because we are going to have again more cases, and we are going to extend on one time these contractual nurses as their right to demand for permanent basis to have their jobs. Number one, it will create a more issues which we have already in the Delhi government and central government hospitals in Delhi. So daily wages, not at all, because they are not. If something happens by, they should not happen. If something happens to their infected or their, if something happens to their these contractual or daily basis nurses, or daily wage based nurses who are going to who are going to be recruited as a family, who is responsible for that? Will the state take responsibility? Will they themselves should take responsibility? Such we have seen every day now the death nurses are dying in Delhi hospital itself. So who are responsible for them? That is a big question mark. So our suggestion, there are many nursing associations and nursing activists are having a suggestion that there is already a list of merit list available with the central government. Recently there was a recruitment of nurses in uh, central government hospitals, and the examination is conducted by AIMS. They have a meritorious list, which is their right, because for the jobs, all every each and everyone has a equal and should have an equal right to apply. So there is a huge list which is pending, and they can use the remaining merit list students to come, merit list candidates to come and join the hospital within few days. It will, number one, how it will help, they will have permanent nurses who are going to work dedicatedly, and the nurses themselves have a right to have a all working right. So number one, number two, there'll be trust built. It's my hospital, I have to, this is my institute. They will be doing more than what you expect during this time from them. Anyhow, nurses are doing their best during this time, but you can expect more from them if you recruit them on a permanent basis, which the list you have already. That's, I request again, I appeal government of Delhi and government of Ministry of Health and Family Welfare to think on this. Please look at your merit list which we have with yourself and try to recruit them, so that you will not able to face again the many of the issues which we are going, which state will face having on contractual.